Dear participants, my name is Tine Hooijmans and I'm Associate Professor of Sanitary Engineering at IHE Delft. And on behalf of the whole consortium, I will give a presentation on the project Risk Wash, which is a risk-based approach to humanitarian sanitation decision-making. And I would like to thank the organizers of the conference for the opportunity to share with the participants the ideas behind the project. And yeah, we would welcome any feedback and questions afterwards. So the reason to develop the project is, well, we all know that in humanitarian settings, people are more prone of contracting fecal-oral diseases such as cholera. And also in the camps, the conditions are very suitable for their rapid spread. Now, the primary barrier for the transmission of fecal-oral diseases is sanitation, and there is a need to tailor public health approaches and interventions, especially when you have limited funding available. And also data and tools are required to help in the decision making. And these considerations led to the development of the Risk Wash project. The context is that we work in a humanitarian setting. So we have 2 camps in Bangladesh, Cox's Bazar, and in Uganda, Imvepi. We have identified 6 different fecal sludge treatment plant catchment areas, of which 5 in Bangladesh and 1 in Uganda. We are working together with academic, research, humanitarian, and governmental organizations. And we have selected 3 PhD students to work on the project, and we will have 18 MSc students. And the duration of the project is 4 years. The approach that we are following in the project is risk-based, and we will use different tools that are already existing and developed, and we will modify them and trial them out in a humanitarian context. So you see here also some pictures I've taken from literature. So the first one is a SANIPATH-like approach to quantify the health risk, not only in the public, but also in the private domain for different transmission pathways and also for different groups, including vulnerable groups such as elderly and people with disabilities. And the transmission pathways, you can think here of toilets, open drains, soil, drinking water, food, etc. And the other tool that we will use is the sanitation safety planning approach. So that's a semi-risk based approach, and we will assess the health risk profiles, but also the environmental risk profiles across the sanitation value chain. And the third one is we will evaluate how the FSDPs perform. So not only the chemical analysis, but we also do the pathogen removal efficiencies using DNA extraction, PCR, and then Techman array cars in which you can detect a lot of different pathogens. And finally, we will perform a quantitative microbial risk assessment, QMRA, and we will use the data that we acquired in the different tools that I described above. An important aspect of the project is knowledge sharing. So the MSc and PhD studies will result in thesis and scientific publications, but we will also develop training materials on the tools, and they will be trialed and further developed for the humanitarian sector and water sector professionals. We will develop protocols for participatory research that we will apply, and also for the sampling and analysis. And we will develop a health impact framework to support the decision making. Furthermore, the content will be open source and shared. We aim to do it via website, webinar, blogs, but we also will look for other possibilities to be able to reach out and to share the material. And we will also give workshops on the tools, and it will be 6 workshops in total, 3 in Uganda, 3 in Bangladesh, and they are aimed at professionals working in the humanitarian sector. Now here you can see an overview of the consortium partners. We have yeah, you can see the academic organizations and the NGOs from Bangladesh and Uganda, and we're also very happy with the advisory members, among which also the technical working group on fecal sludge management, so the TWIC of the Global WASH cluster. Yeah, so this was the final slide, and I'm really looking forward to questions and feedback.